The topic that I chose for this assignment was a topic of health care accessibility in Texas. This topic in particularly really struck out to me the most out of the other ones because I myself am a Texas native and a type 1 diabetic, so I know the struggles and the hardships that many of Texans currently are facing and that have faced in the past with how hard and difficult the accessibility of healthcare is. This topic is important not only because I have firsthand-handedly have to deal with the repercussions of the healthcare accessibility being very difficult, but because this is a matter that nobody should ever have to deal with, especially when it comes down to any of the Texas citizens' health concerns. One of the biggest challenges in Texas residents are having to deal with currently is a lack of affordability. Many residents had to cut down on or completely stop attending medical appointments, receiving medication, or any additional help regarding their health because the cost is too high and the help is too low. This in particular has had a greater effect on the minorities residing in Texas, such as the Hispanic and Black communities. According to the article, Access to Healthcare Among Latinos of Mexican Descent in Colonias in 2 Texas Counties by Larry Ortiz, barriers to healthcare within minorities are numerous and include language and cultural difference, the lack of health insurance, and the high cost of healthcare. According to KFF.org, the graph that I'm about to show you are some of the reasons that many Texans are postponing needed care. So in orange, 75% could not afford costs, 29% could not get an appointment soon enough, and 20% could not open. The offices were not open, so these are people who are uninsured. 75% of Texas citizens are uninsured, and the rest are employees and Medicaid, but even then, many people are still not getting the assistance that they need because, again, the cost is too high. The way that I would try to fix this issue at hand would be by implementing an assisting program that would allow for residents to pay a very minimal amount that would then allow for them to seek out the medical attention and receive the medication that they need without any further pay or any other repercussions following after that. And some of the criticism that I believe I would definitely receive from this is that many residents who earn a higher pay would seek out any excuse or say that their tax dollars are going to people who don't want to work and are being lazy, which in many cases is just not true. But because this is a problem that people are facing now, that people are saying that their tax dollars are being wasted on, and it says a lot about the community willingness to help. So my simple response to those who think that their tax dollars would simply be wasted away, I would remind them that healthcare accessibility is a right, and it's not a privilege. It's not something that any of us should judge or be judged by someone's financial state. So that's what I would change, and that's how I would try to change it.